Eric Ferguson was taking out the trash one night when he felt something sting his leg. He looked down and saw the two distinct imprints of a snake bite. The next moments would add up. 15 miles to the hospital, 18 hours in the emergency room, 4 vials of antivenom, and an $89,227 bill. The highest ticket was $81,000 for the antivenom, or $20,000 a vial. But when Eric and his wife Laura searched online, the antivenom could be found for as low as $750. The couple was relatively lucky. Insurance stepped in. They had a deal with the hospital that lowered the amount to roughly $20,000, and the Ferguson's share of that final bill was only $5,400. Similar scenes take place across America several times a day. An emergency leads an unlucky soul to the ER. A large 5, sometimes 6-figure bill is racked up in no time at all. And then the American healthcare system begins its sorting process. Are you covered by Medicare or Medicaid? Does your insurance have a deal with the hospital? Awesome, your costs will be relatively minimal. Are you out of network, uninsured, or just so happened to get an anesthesiologist who wasn't covered by your insurance even though the hospital was? Well, you just won a lifetime of medical debt. So many Americans have been left in the dust by our healthcare system, and everyone thinks the other side is to blame, but the real problem lies in our government's involvement in healthcare and the way our insurance works. If you haven't watched last week's video, the part 1 to this video, I highly recommend you do. We dug into the way politicians in the medical industry have made the problem of rising healthcare costs worse for their own profit. But in this video, we'll take a more bird's eye look at how payment works, why it's so expensive, and how we can fix this mess. My name is Maggie. Welcome to Undoctrination. As I said in last week's video, this book, Overcharged: Why Americans Pay Too Much for Healthcare, is incredible. I highly recommend reading it if this video sparks a deeper interest. I also recommend reading Recovery by Michael Cannon. He's a healthcare policy expert who graciously took the time to answer many of my questions about the industry, and I've sprinkled many of his wise words throughout this video. With all that being said, let's get into it. What if I told you that insurance is hurting more than it's helping? You might call me crazy, but hear me out. We are all self-interested beings at the end of the day. Hospitals, insurance companies, and doctors all want to make more money, just like you want more money from your work. Prices are set when two parties' self-interests align and both sides get what they want from the other. In healthcare, we get the services we need, and doctors get paid. But in the equation of healthcare pricing, there's a third party standing between patients and providers: insurance. Because consumers are increasingly insulated from prices via insurance, they have risen over time. To illustrate this, let's take a trip down history lane. Around World War II, Congress did something insane. They placed temporary price and wage caps, and jobs began looking for new ways to attract talent. Companies lobbied the government to not count ESI premiums, so your monthly insurance payments through your employer, as taxable income. So, getting health insurance through your employer became a really attractive offer for job seekers because it was cheaper than spending already tax income on insurance plans. This is how our insurance became so tied to our employment status. The passage of Medicare would come soon after, and it covered America's seniors. In the years between 1945 and 1965, the number of Americans insured rose from 22.6% to 72.5%. That's crazy good, right? Not so fast. In that same time, the amount doctors charged for their services rose 1.7 times faster than inflation, and a hospital stay in 1970 would end up costing 5 times the amount it did in 1950, which is kind of weird, right? Like, what happened there? Shouldn't healthcare be getting less expensive? Well, as it turns out, when you increase the amount a patient can spend with insurance, doctors and hospitals raise prices. What happened here was decreased price sensitivity among patients, and it caused the price of healthcare to skyrocket. We don't look at prices as closely as we would without insurance, and hospitals aren't exactly handing out pricing menus. Insurance has lulled us into complacency about healthcare costs when we're in network. Charles Silver and David Hyman write in Overcharged. In recent research, Amy Finkelstein, a professor of economics at the Massachusetts Institute of Technology, estimated that the spread of insurance was responsible for about half of the six-fold increase in real healthcare spending per capita that occurred from 1950 to 1990. In other words, insurance caused healthcare spending to triple. Crazy. The third-party effect on healthcare pricing is most apparent in the astronomical line item costs on your hospital bills. These are called charge master rates.
So the government pays for half of medical care itself, and it sets the prices there. The hospitals are negotiating prices with those insurance companies and keeping those prices secret. What you're going to do is you are going to set a very high price for every service that you offer. And we call that the charge master price. You might think of it like a list price, like car dealers set. And then they will negotiate a discount, as small a discount as they need to do to get this insurance company's business and that insurance company's business. Then keep all those prices secret so that no one else can use them as a reference point in their negotiations. Okay, so the insurance companies are maybe getting those prices down, but they're really inflated charge master prices, so the insurance companies are probably overpaying already. But if you're someone without health insurance, or if you go to a hospital that is not inside your insurance company's network, or if you go to a hospital and just one of the doctors that treats you was not inside your insurance company's network, then you're going to be hit with that charge master price from that hospital.
If a hospital sets the charge master rate of a service at, let's say, $10,000, they may negotiate a discount with your insurance company that brings it down to $3,200. This is how in-network services cost less. Then let's say your insurance company ends up covering $2,500 of that out of obligation to your contract, and you're left with a $700 bill for the service. That initial rate of $10,000 is obviously a starting point for negotiations with insurance companies. But let's say that service was done in an emergency, in an out-of-network hospital, or involved an out-of-network physician, even though the hospital itself was in network. Now you're in trouble. You are on the line, and suddenly you're not so complacent. But your ability to pay doesn't matter to the hospital. They'll come after you and garnish your wages. You think you have the negotiation power of an insurance company? Not so. Overcharged tells the story of Peter Dreyer. He was told he had to have neck surgery. He researched his insurance coverage and thought he knew what to expect, but after the operation, he received a $117,000 surprise bill from an assistant surgeon he hadn't known about or met. The bill was 20 to 40 times the usual local rate and orders of magnitude larger than the $6,200 fee charged by the primary surgeon. The same happened to Patricia Kaufman, who faced a $250,000 charge because two of the plastic surgeons who sewed her up happened to be out of network. Her insurance only covered $10,000 and she was left with the rest of the bill. And these stories are just two among so many Americans whose lives have been nearly destroyed over this practice known as balance billing. I mean, I would lose it. This is not okay by any stretch of the imagination. And you might be thinking, wow, this is exactly why we need insurance. And insurance companies are hoping you'd say just that. This whole situation is happening because of insurance domination. And the reason so many of us are insured at such high levels is because of government intervention. Let me ask you this. Is there a better way to do insurance? I think there is. But many Americans, maybe even you listening to this video, believe the solution is single-payer, socialized healthcare. And first, let me say that I empathize with where you're coming from. Healthcare in America can feel apocalyptic at times, and people have several arguments for socializing healthcare. First, they assert that healthcare is a human right. Sure, you have the right to choose what kind of healthcare you pursue, but you don't have the right to free labor or other people's property.
Give me that.
What?
Give me that.
But to the extent that the government is taxing you to fund this system, or really taxing you for any reason, it is taking away your right to choose how to spend your money on healthcare. In some cases, in some countries, requiring you to get healthcare through that government program, to go outside of a Medicare for all system. The first problem with government-run healthcare is that it violates your rights to make your own health decisions.
The second argument is that we'd actually spend less if we socialized healthcare. As I mentioned in part 1, our spending per person in America is dramatically higher than other other nations, but there is no evidence to suggest that moving towards the fully socialized model would bring down costs. There is an abundance of evidence, however, that it would cause spending to increase. When Obamacare expanded, our national spending on healthcare rose from $2.9 trillion to $3.2 trillion over the course of 2 years. And as we've seen in the past, when patients receive a smaller and smaller final bill, people use more healthcare, meaning we actually use more resources. Those resources don't just fall out of the coconut tree. They come from your paycheck through taxes. It's some demonic form of girl math where no matter how much of our income is taken before the point of needing a service, all we react to is that final bill. And when that final bill is totally removed, all bets are off.
But if real math doesn't work, then we transition to girl math and we use it to live.
Medicare is already subject to so much fraudulent and wasteful spending, as we illustrated in part 1. What makes you think that a fully socialized system would be any better? Michael Cannon pointed out another number of issues with this system when we chatted.
In the case of the Veterans Health Administration here in the United States or the British National Health Service in the UK, you get persistent shortages in some areas and persistent gluts in other areas. You have people waiting for care, the government rationing care by waiting, and patients even dying while they're waiting for care, because in a government-run system, you don't have the price mechanism to move resources from where people don't need them to where they do need them. In the United States, there's this huge disincentive for healthcare providers to invest in quality. That distance came to us via the Medicare program and other government interventions. It would not exist in a free market because a free market would require healthcare providers to improve on all dimensions of quality.
So if socialized healthcare is not the answer, what is? First, we need to detach health insurance from jobs by removing laws and regulations that interlink the two so closely. This would provide a level playing field for new types of insurance to enter the market, and Americans would feel free to buy the level of coverage they actually needed. Health insurance, in an ideal scenario, would work similarly to car insurance. Most people would buy catastrophic insurance, covering the really expensive and intense stuff, and pay out of pocket for the rest. Car insurance steps in when you get into an accident, but you're not using it to cover oil changes and routine maintenance. Without third-party rule of healthcare, providers would start operating differently, which we've already seen happening with certain services like LASIK, immunizations, and Botox. A doctor down in Florida advertises vasectomies for $590 on billboards and occasionally runs sales.
I make that deal. How about you bitch? You make that deal?
I make that deal.
I don't blame you. Damn good deal.
You'd also likely see more clinics offering monthly concierge services where you see all of your providers in one building and pay a flat monthly fee to go to all of your appointments. And for those catastrophe plans, reverse deductibles could make patients more price sensitive, causing prices to decrease. Michael Cannon explained in his book, quote, "Patients can use any healthcare provider they wish, and the insurer pays the same fixed amount per procedure, no matter which provider the patient chooses." With this kind of plan, providers actually have to compete for our business and make prices more transparent to attract us. One experiment showed that over 2 years, the reverse deductible plan brought down the cost of different healthcare services, including a 21% reduction in the cost of a colonoscopy and a $16,000 reduction in the price of joint replacements at high-priced hospitals. This more free market approach would make the industry have to truly respond to our needs. We know what's driving up healthcare costs. It's not a mystery. And yet, politicians in Washington, D.C. failed to act in a way that would create a system truly for the people. When the power of the purse is in our hands, not the insurance companies or the bureaucrats, the system acts in our favor. I hope you enjoyed this video, or both videos if you've made it all the way through. Congratulations! I hope you feel like you're leaving with more of an understanding of our healthcare system. Remember to like, subscribe, click the bell for notifications, and leave me a comment, and I will see you guys all next week. Ciao!